Good afternoon, everyone. Honored to be seated next to the woman on my right who needs no introduction, the Commissioner of the Department of Health, Judy Persichilli. To her right, the COVID-19 response medical advisor and former state epidemiologist, Dr. Eddie Bresnitz. Great to have you both. Guy to my left needs no introduction, the Superintendent of the State Police, Colonel Pat Callahan. We have Jared Maples, the Director of the Office of Homeland Security and Preparedness, Paramel Garg, Chief Counsel, and a cast of thousands. This week marks Black Maternal Health Week, and with that, I want to salute all the hard work being undertaken by First Lady Tammy Murphy in partnership with our state departmental leaders, hospital and healthcare leaders, and community leaders and advocates, among so many others. Our goal, their goal, and our goal is nothing less than eradicating racial disparities in maternal health and making New Jersey the safest state in America to have a baby and to raise a child. So to all, we recognize all that you are doing and remain committed to working alongside of each of you. Now, I must start by reiterating our announcement from yesterday of our decision to temporarily pause the administration of Johnson & Johnson's vaccine upon the recommendation of the Centers for Disease Control and Prevention and the Food and Drug Administration, pending further investigation into 6 reported instances of severe blood clots following vaccinations. Now, for sure, these 6 cases each appear to be extremely rare and serious, as there have been nearly 7 million doses of the Johnson & Johnson vaccine administered nationwide. And in New Jersey, where we had administered just over 244,000 doses of the Johnson & Johnson vaccine prior to hitting pause, no similar adverse effects have been reported. Even with this pause, our overall goal of vaccinating 4.7 million adult New Jerseyans by the end of June remains not only in place, but entirely achievable. As of today, doses of Johnson & Johnson have accounted for only about 4%, Judy, of the more than 5.6 million total vaccine doses we have administered. I want to repeat that no one who has received this vaccine should panic or worry. This review by the CDC and the FDA is coming out of an abundance of caution. Moreover, this review is critical to our efforts, both statewide and nationwide, to ensure confidence in our vaccination program and in the vaccines themselves. I will ask, if it's okay with her, Judy, to speak further to the work of the department in light of the CDC and FDA recommendation and how she and her team are working with our vaccination sites to assist those who were scheduled to receive the Johnson & Johnson vaccine. But it bears repeating that there have not been any similar reported adverse effects with Johnson & Johnson's vaccine in New Jersey, nor have them been, by the way, from either the Pfizer or Moderna vaccines. This pause also has no effect on Monday's opening of vaccine eligibility to all New Jerseyans age 16 and over. We will keep pushing forward with the tools available to us. And again, I know that Judy will have more to say on this, and she and Dr. Bresnitz and I will answer your questions in a few moments, as we always do. Next up, switching gears, I am proud to announce that through the American Rescue Plan, we are taking steps here to make health insurance more affordable for hundreds of thousands of New Jersey residents who purchase policies through our state-based exchange, Get Covered New Jersey. Because of the new savings available under the American Rescue Plan, the Department of Banking and Insurance, under Marlene Carita's great leadership, has reallocated some of the money we are providing for state subsidies to help more people. For the first time ever, state and federal subsidies will be provided to residents at higher income levels, and residents previously eligible for financial help under the Affordable Care Act will get even more savings. This new financial help will be available starting tomorrow at that website, getcovered.nj.gov. As we had previously announced, enrollment through Get Covered New Jersey is open through the end of the year, but the sooner you sign up, the sooner you have access to health coverage and the new savings available. If you are already enrolled, you will likely be able to claim additional savings. If you need coverage, check out your options. And if you received unemployment compensation in 2021, you may be eligible for nearly free coverage. So again, please go to that website, getcovered.nj.gov, beginning tomorrow. Now, moving on, let's take a look at some of the numbers that we have coming in. First, on vaccinations, we are reporting today a total of 2,292,316 fully vaccinated individuals. The total number of doses administered by both Pfizer and Moderna vaccines is just under 5.4 million, and the stability of their supply and distribution is why we remain confident of our ability to still meet our June 30th vaccination goals. We are reporting today an additional 3,786 reported positive cases. That's combining PCRs with presumed positive antigens. The statewide rate of transmission continues to trend, Judy, in the right direction, downward, and today it is at a 7-day average of 0.92. The rate of positivity, on the other hand, of 24,396 PCR tests recorded on Saturday was 11.04%. That does not surprise us in the least. We've said this many times, that the positivity rate from Monday through Friday has been in the 7 to 8% range now for a couple of months, and sure enough on weekends, because of fewer tests, people testing with an adverse selection, they don't feel well, it goes into the low double digits. We take it seriously, believe me, but that is not surprising. Looking to our healthcare systems, last night there were a total of 2,281 patients being treated across our 71 hospitals, and this includes 2,140 who have already tested positive. Our intensive care units were treating 457 patients, and there were 254 ventilators in use. Throughout the day yesterday, 297 live patients were discharged, while another 271 new COVID-positive patients were admitted, and our hospitals not yet confirmed, none of these are confirmed, reported 24 in-hospital deaths. Notwithstanding that they have not been confirmed, we are reporting an additional 43 confirmed losses of life due to COVID-related complications, and that is with the heaviest of hearts. The number of probable deaths has been revised upward by a net number of 19. As we do every Wednesday, we revisit that. That's now 2,592, and these remain under investigation by Dr. Ed Lifshitz and his team at the Communicable Disease Service. I believe if you combine 22,414 and 2,592, you will note that we have crossed 25,000 losses of life, almost or beyond unfathomable. As we do every day, let's take a couple of minutes and remember several more of those we have lost. First up, we remember this guy, a friend to human and four-legged creatures, Dr. Adel Hamdan, a veterinarian who was a longtime member of the Clifton community. Dr. Hamdan was 74 years old. He was born in Jerusalem and earned his degree in veterinary medicine from the University of Baghdad in 1972. Soon after, Dr. Hamdan made the decision to come to the United States and New Jersey, along with his brothers, Dean, a physics professor at Montclair State University, and Adli, an engineer and finance professor, now in Jordan. At first, he couldn't practice veterinary medicine, but during breaks from his job at a grocery store, he prepared for his U.S. qualification exams, which he passed, and by 1976, he was heading his own practice in Maywood. He would later own and lead the Totowa Animal Hospital. Outside of his clinics, Dr. Hamdan was a leader in the community, a past president of both the Maywood Rotary and the American Doctors Association of New Jersey. Besides his brothers, with whom he joined in their search of the American dream, Dr. Hamdan leaves behind his wife of the past 12 years, Alia, his children Adam and Nadia, and his grandson Richard. He's also survived by his sisters Abir, Aisha, Anbara, Awatif, and Aida, and many other relatives. And of course, he leaves behind many dear friends of both the two- and four-legged variety. I spoke to Aliyah, his wife, on Monday night because I had tried her a couple of times. She got back to me later. She's not a doctor, but she runs the veterinary hospital and ran it for Dr. Hamdan. And the reason she couldn't pick me up earlier, she was accompanying the medical professionals making the rounds at the veterinary hospital. We are honored that Dr. Hamdan chose to make his home in New Jersey. May God bless him, and we thank him for his years of community service. Next up, we honor Cranford's John Grieve, that's John on the lower right, who we lost at the age of 86. A native of Garwood, John enlisted in the United States Air Force out of high school, serving as an airman first class during the Korean conflict and earning multiple military honors. Upon his return, he embarked on a 3-decades-long career with Bell Telephone, while also working on the side for Premier Electric in Garwood, compiling a total of more than 50 years there. He served as an active member of both the Cranford and Garwood First Aid Squads for over 30 years, with notable time spent as both squad captain and president. John is survived by the 4 ladies standing behind him: his daughters Cindy, Penny, Linda, and Katie, and their spouses, along with his 9 grandchildren: Jessica, Carrie, John, Stephen, Luke, Emily, Ed, Holly, and Caitlin, and 4 great-grandchildren: Jackson, Bella, Avery, and Casey. He's also survived by his brothers Charles and William and his sister Dorothy and many nieces and nephews. I spoke with his daughter Penny on Monday and had a really deep conversation about her dad, and Penny herself is a first responder. So thank you, Penny, and to your sisters and the entire family there. We thank your dad for his service both to our nation and to his community, and may God bless and watch over his memory and his tremendous family. And finally today, we remember, she's in the middle of that picture, Alice Houston. Alice was born in Jersey City, but called Monmouth County home for the past 65 years, from Union Beach to Keyport to Hazlitt to Homedale. She was 73 years old and had been a resident of Homedale for the past 37 of those years. Throughout her career, Alice wore many hats. She worked for the Monmouth County Action Program in Asbury Park. That's a community service organization that served and empowered families in need across Monmouth County. She would serve as a supervisor and bookkeeper at the New Jersey Turnpike Authority. And after that, she worked alongside her husband, Jim, who's on her left there, as he built his law practice in the Keyport and Hazlitt areas. And she was a top realtor along the Monmouth Bay Shore for more than 35 years. And I've heard from a lot of people about Alice. She was known and beloved by many. But behind all of her energy, not surprising from that picture, was her family. She is survived by Jim, her husband, and their children, Michelle, Allie, and Christopher, and their families, including her 7 grandchildren. And I think we got a lot of them right there: Madeline, Caitlin, Colton, Jake, Will, Sam, and Molly. I spoke with Jim and Alice's son-in-law, Paul, on Monday. What an incredible life she lived. Alice also leaves behind all 9 of her siblings, which means she will also be missed by countless, not just siblings, but by nieces and nephews. For all she did for the communities in which she lived, we pray for God to bless Alice for a lifetime of good work and good deeds, and may God watch over her, her memory, and her incredible family. All 3 of those we remember today were cornerstones in their communities. May their legacies of service and caring for others be carried forward. Before we move on, I wish to note that FEMA has begun offering funeral cost reimbursements to financially help families who have lost a loved one to COVID-19. In general, applicants who lost someone to COVID-19 going back to the beginning of the pandemic may be eligible for $9,000 for any costs related to a funeral, as well as burial or cremation costs. I would encourage every impacted family to visit that website, disasterassistance.gov. That's disasterassistance.gov for more specific eligibility information for this financial assistance, and then to call 1-844-684-6333. That's 1-844-684-6333 to apply. It must be noted that applications for assistance are only being taken by telephone. Again, the website is to get information. You got to use the phone number there to apply. We know how tough funeral expenses have been for many families already reeling from the economic impacts of the pandemic, and thankfully this help is available to you. Now, almost there. Staying in the Monmouth County area, I want to give a huge shout out to this guy, Chef Lou Smith, the owner and executive chef of Blend on Main in Manasquan, and the founder of Chef Lou's Army, which has its reach overwhelmingly into both Monmouth and Ocean counties. Created after the pandemic hit, Chef Lou's Army has spent the past year providing free and nutritious meals, as I mentioned, to Monmouth and Ocean County families and seniors in need, along with the families of our healthcare workers and first responders. Over the course of last spring, Chef Lou's Army cooked and delivered more than 1,000 meals every day. But Chef Lou and his Army aren't done, and they've recently partnered with the New Jersey Economic Development Authority through the new Sustain and Serve NJ program to keep going. And with a $250,000 grant in hand, I know Chef Lou is ready to keep the Army going strong. I had the opportunity to check in with Chef Lou on Monday. We had a great call. I thanked him for all that he is doing. He is just a man who loves to cook and loves to feed those in need of a meal. Take a moment to visit him at cheflousarmy.org. No apostrophe, cheflousarmy.org, or stop off and say hi next time you're in Manasquan. I also want to give this shout out. Lou's got a big fundraiser coming up on April 26th at the Manasquan River Golf Club, and importantly, he's doing it in combination with the organization A Need We Feed, and we have already acknowledged A Need We Feed in a prior press conference. So two of these great organizations, Chef Lou's Army and A Need We Feed, both of which are part of the New Jersey Sustain program, Sustain and Serve NJ program, are teaming up, and that fundraiser, again, is April 26th, Manasquan River Golf Club. That same website, cheflousarmy.org, has the details. And finally, today, I wish to acknowledge today's celebration in Israel and among our Jewish community of Yom Ha'atzmaut, the day on the Hebrew calendar which corresponds to Israel's Independence Day in 1948. Ever since the founding of the State of Israel, which, by the way, President Harry Truman acknowledged 11 minutes after its founding, New Jersey has been a mutual partner in a close cultural and economic relationship. A driver of this relationship has been the New Jersey-Israel Commission, which was established in 1989. To coincide with today's celebration, I recommit New Jersey to our continued partnership with the State of Israel by naming the 76 public members of the New Jersey-Israel Commission, including the reappointment of dear friends co-chair Mark Levinson and the appointment of his new sister co-chair, another dear friend, Karen Elkis, among many others. And that list includes former Israeli ambassadors Danny Dayan, another dear friend, and Michael Oren. These members represent the true depth of the Jewish community in New Jersey, hailing from the worlds of business, journalism, music, diplomacy, government service, and community engagement, technology, medicine, academia, and many others. And we'll work alongside the Commission's outstanding Executive Director, Andrew Gross. I congratulate this entire extraordinary group, and I look forward to seeing all the common good that continues to flow from the New Jersey-Israel Commission. And with that, please help me welcome the woman who needs no introduction, the Commissioner of the Department of Health, Judy Persichilli.
Thank you, Governor, and good afternoon. Well, the department understands that the pause in the Johnson & Johnson vaccine has raised some concerns about receiving COVID-19 vaccine overall. It's important to remember that your risk of getting seriously ill or dying from COVID-19 is much greater than experiencing this extremely rare possible side effect that prompted the federal government, out of an abundance of caution, to pause J&J administration and take time to analyze the data. We have had no similar reports in New Jersey among those who have received the J&J vaccine. Additionally, generally, the incidence of this type of thrombosis, this clot, without vaccination is also very rare. CDC reported these blood clots have occurred in women between the ages of 18 and 48 with low blood platelet levels. Their symptoms developed 6 to 13 days after vaccination. In New Jersey, 47,266 women in that age group have received the J&J vaccine. But again, we have no similar reports. If you received the J&J vaccine within the last 3 weeks, no matter your age, and you experience leg pain, abdominal discomfort or pain, shortness of breath, or a severe headache, please call your healthcare provider or go to the nearest hospital to be assessed. We are encouraging residents to keep their vaccine appointments for the Moderna and Pfizer vaccine, which have been demonstrated to be safe and effective. The Moderna and Pfizer vaccine use mRNA technology, which is different than the J&J vaccine. We understand that concerns about J&J may increase your hesitancy, but it is vital that as many people get vaccinated to beat COVID-19 in our state, where we have lost 1 in 500 New Jerseyans to this virus. We are concerned about the impact of the variants that are circulating in our state right now, and the possibility of increased transmission as a result of the variants. So when individuals get vaccinated, it helps protect them, their loved ones, and their community. And millions of people in the United States have been vaccinated safely. This pause is a reflection of how seriously the federal government is taking the safety of vaccines. All vaccine sites in New Jersey have taken Johnson & Johnson vaccine doses out of inventory and will not use them until further federal guidance is provided. The department has requested that all vaccinators develop alternate plans for those affected by this pause in the use of J&J, including maintaining the existing J&J vials in appropriately monitored storage conditions and ensure that they remain segregated at this point in time, but ready to be safely used when the pause is lifted. The state will not be receiving J&J until further notice. At this time, we don't know if we will be receiving additional increases in Pfizer and Moderna doses beyond what is expected. Most sites get a mix of vaccine types, so many are able to switch to either Pfizer or Moderna for their appointments. For example, Hackensack Meridian Health announced that they wouldn't need to cancel any appointments at their vaccination sites, which includes Bergen County. It includes the Bergen County megasite, and would provide their other Moderna and Pfizer vaccines in place of J&J. There are no reported issues at the megasites. For example, the Gloucester megasite will provide Pfizer in place of Johnson & Johnson. J&J vaccine was distributed across a number of sites in categories such as the Federal Retail Pharmacy Partnership. That includes supermarket pharmacies, federally qualified health centers, some hospitals, some of the megasites, county and local health departments, and additionally, Walmarts. Over the past 2 weeks, more than 146,000 doses of J&J were distributed to a variety of sites. We have received feedback that sites with Moderna or Pfizer have begun rescheduling those who were scheduled to receive J&J doses while the pause is in effect. The department is also reaching out to sites that only have J&J doses to provide assistance with communication to those affected by the pause, including options to schedule appointments at other locations. J&J only sites are not prepared to receive Moderna or Pfizer. The department's Office of Local Health is contacting local health officials to offer assistance due to this pause. Many are working to accommodate those who were scheduled for J&J. For example, both Monmouth and Ocean County health departments have indicated that they should have enough Moderna and Pfizer vaccines to offer it to those who were scheduled for the J&J vaccine. And the Somerset County Health Office will offer Moderna for those who were scheduled to receive J&J. However, because of its ease of storage and the convenience of being one dose, we were using J&J for some specific populations that would benefit from a one-dose regimen. So those persons will be impacted and may have to be rescheduled to alternate sites if that is possible. We recognize the challenges this pause creates, and we are committed to working alongside these partners to continue to advocate for vaccine supply for vulnerable and specific populations, and to ensure that adequate testing and assist with other COVID mitigation strategies are in place. We are talking with our partners serving these populations and looking at which sites may be able to accommodate Moderna vaccine. Although it would be more complex to administer a two-dose vaccine for some of these special populations, If we need to go forward with a 2-dose vaccine, we will work to do so because we are committed to an equitable access to this vaccine. As you know, CDC has convened an emergency meeting of the Advisory Committee on Immunization Practices today to further review these cases and assess potential implications on vaccine policy. So we look forward to receiving further guidance after their review of the data. Overall, more than 5.6 million doses of vaccine have been administered in the state, and more than 3.5 million individuals have received at least 1 dose of vaccine. So over time, we have been able to increase vaccination among our communities of color. Over the past month, the percentage of Black, non-Hispanic residents with at least 1 dose rose from 5% to 8%. So we do have a way to go in that regard. However, over that same time period, the percent of Hispanic individuals moved from 7% on March 15th to 19% on April 15th, approximating their representation in our general population. The percentages of seniors vaccinated in the state also continues to rise. 80% of those individuals between the ages of 65 to 75 have received at least 1 dose. 75% of individuals 80 and older have received at least 1 dose. On to my daily report, as the governor mentioned, 2,281 individuals are in our hospitals. Our hospital census over the last 7 days has stabilized somewhat. And as I mentioned on Monday, a large percentage of our hospitalizations are under the age of 60. Right now, about 49% of our admissions are under 60 years of age. In December, that percentage was approximately 35%. So we have seen a rise in those individuals being admitted to the hospital in the younger age cohorts, particularly those under 60, from 35% to 49%. There are a total of 1,164 reports of CDC variants of concern in New Jersey. 1,130 of those reports are the UK variant B.1.1.7. Additionally, our reports of the Brazilian variant P1 have risen to 19 total cases. Fortunately, there are no new reports of multisystem inflammatory syndrome in children. 2 of the children affected are still hospitalized. There are no new cases at our veterans' homes, and our psych hospitals report 1 new case in a patient at Ann Klein. On April 10th, Saturday, New Jersey reports a percent positivity of 11.04. The northern part of the state is 10.95, central 10.93, and the southern part of the state 11.43. So that concludes my report. Stay safe, continue to mask up, socially distance, stay home when you're sick, get tested, get vaccinated, and remember, for each other and for us all, please take the call and download the COVID Alert NJ app. Thank you.
Judy, thank you. 2 comments to underscore, one on age, one on equity. And I think you and Eddie would agree there's a correlation, strong correlation between the great progress we've made on vaccinating seniors on the one hand, who we know are the most vulnerable, and the flip side of that coin is a younger demographic getting sick in the hospital. And then on equity, great progress, although it's a journey. I think African-American number was 8%. That's up against plus or minus 13% as a general population matter. Latino numbers closer to the actual representation. The flip side of that, on the bad news side, there's no question that Johnson & Johnson hiccup is a challenge, in particular in the equity piece. I'm sure you would agree. So for instance, a homeless population, to pick that population, extremely vulnerable, among the most vulnerable. The notion of, and we'll do it if we have to, right? You said we will, if that's what it comes to, we'll do it. But the notion of cold chain storage, 2 appointments is really hard with some of these hard-to-reach vulnerable populations. So God willing, this review by the feds is apace. It comes out with guidance that we can live with, and we get back to some rhythm on that front. But for all the above, many thanks. Pat, whether you got compliance, whether it looks like it's coming down on us a little bit, please help us out there. They used to be called dispatchers, but I think it's Public Safety Telecommunicators Week or month. Either way, we take our hats off to them because they've been central players in this pandemic fight. But any or all of the above and whatever else you got, and let's keep recruiting candidates to become state troopers.
Thanks,
Pat.
Governor. Good afternoon. Since we last met, we do have one EO compliance citation that was issued. Haddon Township Police responded to a landlord-tenant dispute. The tenant had her utilities shut off and her belongings out on her front lawn, which is in violation of the executive order protecting those from illegal evictions, and the landlord was cited, Governor. With regards to the weather, we are expecting a serious amount of rain in the next couple of days, so we're keeping an eye on that. And I'm glad you brought up the public safety telecommunicators. It is their appreciation week. I stopped up at the Rock Call Center yesterday to thank them personally. I was at Hamilton Dispatch Center. I'm going to hit Totowa tomorrow. They have been the lifeline for first responders and citizens for more than the past year. In the past year, over 240 million 911 calls alone across America, and they do a phenomenal job. Again, troopers, whether it's traffic accidents, calling in stops, 911 calls, motorist aids, a phenomenal group of women and men that sometimes they don't do it for the glory or for the certainly for the recognition, but in this week we take the time to thank them for being that lifeline to the men and women who are our first responders and certainly our citizens. And to your point, 9 days left in that application process. I was on with George Gore and the AG this morning on his radio show. It's a constant push in these last 9 days. So njtrooper.com is where all that information is in a time when we know that there are women and men out there that want to step up and join us in this call to action and be part of the next century of service. So thank you for that as well, Governor. That's all I have.
Are you, rumor has it you may be on Open Line on one of my favorite stations, WBLS, on Sundays?
That is correct. 8 o'clock Sunday morning.
I love
will
that.
be on that again, continuing the push for the application process.
Fatine and Jennifer and the whole team there are our best. You know, folks who answer the phone, in this case specifically the public safety telecommunicators, but I'm thinking processing your unemployment claim, your call center, how many calls a day are they fielding? 20,000? 20,000 calls a day are being answered by a live person on the call center. I mean, there are the FEMA support for funerals, which I just put up, and I made the note. You can go online to get the information, but you got to call. Somebody's on the other end. That's a federal program, obviously, but it has been the glue. How many 911s you say? 240 million?
Yes, sir. 240 million calls in the country.
Staggering.
Wow.
It's absolutely staggering. So thank you for all of the above. And by the way, please, folks, this has rarely happened, but landlords cannot throw folks out on the street. There's a moratorium in place. Please, I know everyone is abiding by that, including landlords who themselves are suffering. We've got a landlord assistance program in place for a reason. We completely get that, but there cannot be unilateral action that takes a home from out from under somebody. Again, we're going to be virtual tomorrow. I know I've got an event tomorrow that's not specific to COVID, but perhaps we'll have COVID numbers. Friday we'll be on the road somewhere, but we'll continue with the rhythm we've had of late, and then we'll be virtual over the weekend. And unless you hear otherwise, we'll be back with you right here Monday at 1 o'clock. So with that, Dante's got the mic. Matt, we'll start with you. Good afternoon.
Good afternoon, Governor. Commissioner, are you able to be more specific on how the state plans to get vaccines to people who are homebound and in difficult areas of community to get these shots without J&J? I know you touched on it a little bit, but just curious about specifics. And are any of the vaccination sites tapping into any Pfizer or Moderna second dose reserves to meet the sudden schedule changes? And lastly, Governor, 34 undocumented immigrants are on day 8 of their hunger strike, and they say they're going to keep on going until there's a commitment from your office to help to help excluded workers. Have you revisited using CRF funds like other states, or are you looking at using American Rescue Plan money? Also, have there been any updated ongoing talks with the legislature about stimulus checks or unemployment payments for undocumented immigrants?
Judy, I'll start and throw it over to you. I predict you're going to say it is to be determined, given we just heard this yesterday in terms of how we deal with homebound, homeless folks that are hard to reach. But any thoughts you've got? To the best of my knowledge, we're not dipping into the second dose supplies, but Judy can correct me if I'm wrong. And again, our hearts are broken at anyone who finds it necessary to be on a hunger strike. So please, God, know that we care deeply about this. And we are trying very much, if not desperately, to find a good solution here. And I'm confident we will find something. There was a meeting, I know, with some of the representatives of advocates, with some members of our team yesterday. Paramel, you were a part of that, I know. We're looking at all the above. CRF, more likely ARP money, American Rescue Plan money. And again, it's because we want to do right by every single human being, but it's also because unless we care for all of us in this state, not some of us or not most of us, but all of us, unless we bring all of us along, we will not find our way through this challenging journey. So to be determined in terms of what that actually looks like. Judy, any comment on hard to reach folks that otherwise would have, where we would have used J&J and or preservation of the second dose?
Sure. Let's talk about the second dose first. We've asked everyone to make sure that they put aside their second dose so that we don't complicate the problem. We do a count of inventory, how many doses are on the shelf every single day, and we expect that all doses be moved within 7 days and that there's no more than a 3-week inventory on the shelf. We are moving that guideline down to 2 weeks and encouraging all sites to use as many first doses as possible to make up for the scheduled appointments that had to be paused. We also, and that's the analytics and allocation team. We also have a team that just looks at vulnerable populations. They will be meeting going forward after we hear what ASAP has to say today. They will be meeting to make alternative arrangements for those hard-to-reach populations. It will be somewhat complex because of the reporting and monitoring and follow-up for the second dose. But if we have to do that, we will do it.
Something just happened. Something happened to Judy's mic there, so if you could make sure we're still plugged in. Judy, can you say something else again, do you mind?
Can you hear me?
Oh, yeah, there you go. You're back. You're back. I meant to say one other point. We had a meeting with some leading, both representatives from the Assembly and a separate one with the Senate. And I want to give Senator Ruiz a shout out to your last question about trying to find legislative or other means by which we can get money to the undocumented population. Again, she deserves a shout out because she's a leader on this and she was extremely passionate about it. Thank you. Alex, good afternoon.
Good afternoon. For Dr. Bresnitz, since students, schools, and children didn't end up being the virus vectors that we feared, was it a mistake to close schools down and send kids into remote learning for as long as we have? For the Commissioner, you mentioned the homeless population. Can you tell us some other populations that were being given the J&J dose and how the progress in that area is affected by the pause? And for the Governor, teachers' unions in Trenton are resistant to Mayor Reed Guscior's plans to reopen schools for in-person learning, partial in-person learning on May 3rd. They say that sending students back into the classrooms for 6 or 7 weeks, 2 hours a day, or 4 hours a day, 2 days a week, I should say, is not going to help with learning. The mayor says this is necessary for basically a shakedown for September. What's your view? Who's right there? And lastly, when do you foresee yourself rescinding the state of emergency or the public health emergency? What level do we need to be at? Does the RT need to be at 0? Do we need to be at 0 cases? Because in theory, if coronavirus continues, perhaps even becomes a seasonal illness, you could govern under executive order, in theory, for your entire term in office.
Thank you for that, Alex. Eddie, I'm going to take this one for you. With all due respect, we got clobbered by something none of us had any history with, limited knowledge at best, no capacities, no sense of which habits worked. You make the best decisions at the moment in time. You make those decisions based on the information you've got. I'll let Judy come back to other populations other than homeless. I don't have insight in the particulars of the Trenton situation, so I'll come back to Alex on that if we could. I speak regularly to mayors, superintendents, teachers, union leadership in communities, which I do almost daily. I was actually on with the leadership of the NJEA this morning, not specific to Trenton. Obviously, our mantra from day one has been we need to do it safely and responsibly, but we want to get kids and educators back in the classroom because we know the educational experience is dramatically richer when it's face-to-face. I promise you, we will not keep the state of emergency or the healthcare emergency on the books for 1 minute longer than it needs to be. It just is not something that we relish. It's not something that we want to be doing. We do it because we have to do it. And you know, it's a topic of constant conversation within our team, with our legislative colleagues, and they've been great about that. Obviously, with members of the press. You don't hear it from the man on the street hardly at all. Frankly, that's not they're much more focused on somebody's died in their family or sick, or they've lost their job, or they've lost their business, and they want to know what we're doing for them. And those both of those, the healthcare emergency and the state of emergency, allows us to do a lot more than we normally could for those people. And what do we need to see? I don't have a very specific, this number gets from Y to Z. We'll do it, but we will not hold on to this 1 minute longer than we have to. It's just not. We don't have any more joy in this being the case than anyone else does. Judy, what else other than homeless populations?
We've looked at the homebound population, individuals that do not have a car, where transportation even to a site that may be 5 or 10 miles away would be difficult. Seasonal workers or migrant workers who we know are in the state right now. Many of these, by the way, the vaccination programs had already started. So a percentage of this group have already been vaccinated, primarily by J&J, without any adverse effects. Major senior centers, again, where transportation, or that would be putting them more at risk if they were put on a bus in close contact with one another to move to a site. So the team that we have working on this has identified every single population, about 30 different specific populations in New Jersey, and then they're identifying or have identified plans for each of the groups. So these are the types that come to mind right now.
And Judy, as you said and as I underscored, it's not like we won't get to them. We will get to them. It's just going to be more complicated, and it's going to take longer. And God willing, listen, there's no evidence, and I am gonna pull Eddie out of the bullpen in a minute here, so bear with me, Eddie. We got to give you your money's worth. You're not here for the next few weeks, am I right? So we got to make sure we make this one count. But one outcome here is that J&J gets put back on the boards, right? I mean, there's clearly that is a possibility, or it gets put back on the boards with some caveats in terms of who should be taking it. AstraZeneca is exactly that in Europe right now. They've emphasized seniors for AstraZeneca, not young persons. You could see something like that here. Any event. Sir, you got something? You're good? Okay, I'm going to slip you 20. Thank you. Dave, how are you? You're welcome to say you've got nothing either, no?
No, I do have something, but I would also like the 20 if possible.
Can't have it both ways, my friend.
To get Dr. Bresnitz out of the bullpen, could you speak, Doctor, on the vaccine and medication history that we have in recent times? Do they always, after they go onto the market, are they always problem-free, or do we sometimes see pauses similar to what we've seen with the J&J vaccine pause? How significant is this that the CDC is meeting so quickly, the advisory committee today, and when do you think we would get some kind of guidance about what they're going to decide, and what kinds of things will they look at? I mean, we know some statistics about these individuals that have had the blood clots, but how deeply do they go into this, and how do they figure this stuff out? Governor, you've mentioned that, obviously we want to try to encourage people, especially in minority communities, to not be afraid to get vaccinated because of this pause. So what's your thinking on what needs to be done? How are we going to really encourage these people? Again, because of the history of the way this is played out in this country. And Commissioner, how many appointments do we have a sense have been canceled, and how many have been rescheduled? And how is this working? When somebody gets a canceled appointment, do they go to the back of the line, or are they helped right away and they're fit in? How is this whole system working? And just, Commissioner, if you'd be kind enough to give clarification, you'd given some data on the percentage of blacks. I think you said 8%. We're up to 8% now have been vaccinated. Is that 8% of the total population of New Jersey, or is it of 8% of blacks that have now been vaccinated that live in New Jersey? That's it. Thank you very much.
Dave, I'll start and then turn it to both Eddie and Judy. I'll start with the last one. That's 8% of the total population, with a representation of approximately 13% of the African-American community. So we are 8/13 of the way there, if you will. The Latino number is within a point or two of being all the way there. So again, good progress, but we know we remain on a journey. I want to add to your questions of Eddie, how common is it to see pauses? I think, Eddie, you're going to say the answer is it is common, but I'll let Eddie answer that. How significant is it that they're meeting today? What sorts of stuff are they going to look like? And when do we expect to hear? I'm anxious to hear the answers to that as well. I'd also, Eddie, it was described, the challenges of the 6 women as they were described to me yesterday. It was described as quite unique to have a blood clotting experience, and I'd love you to react to that. And before I hand things over to you and Judy, I continue to be confident, not just in the Moderna Pfizer supply, but I continue to be confident in the system in the following sense. Regardless of where the CDC and the independent authorization committees come out, that the guidance will be guidance that we can take to the bank. Including if that guidance suggests that J&J is back to being okay as a general matter to use, and or it is okay for a particular part of our population to use. But we want to reiterate, in terms of the efficacy, putting aside these 6 cases, which everyone is taking very seriously, the efficacy against hospitalization, severe illness, death, all 3 of these vaccines are money good. And folks need to continue to hear that. Judy, should we go to Eddie first and then back to you on how the appointment situations work? Eddie, good to have you.
Same here. Thank you.
Welcome.
Thank you, Governor. And thanks for those questions. There are several of them there. I'm going to focus on your question looking at mostly vaccines, although I can say for medications, it's the same thing when they do clinical trials and then post-licensure. Usually it's licensure, then they're continually monitoring the safety of the product. But for vaccines, I want to divide it into those what happens during a phase 3 trial and what happens after authorization or licensure. And we had the experience of a pause with one of the phase 3 trials with AstraZeneca. They had this transverse myelitis. They paused the trial, I believe, for a few weeks. And then they restarted after they looked at the data and they felt that, in fact, there was an association. There was not an association between the use of the vaccine and this particular disease. And then, of course, those phase 3 trials occur only in maybe 20,000 or so individuals. So any rarer event is unlikely to manifest itself in a small trial. And so with these vaccines, with the 3 that we had, including the J&J, the FDA assessed and advisor committees assessed that the benefits outweighed the risk, and they authorized their use. It's not surprising that when you put these vaccines into millions of individuals that you're going to find a rarer effect. And I think the commissioner said that the data, or maybe the governor said, was about 1 in a million for these 6 women in the U.S. who've had this unfortunate experience. AstraZeneca also in Europe has had similar experience, and reading the 2 articles that were just published in the New England Journal describing those cases, one came out of Norway, the other came out of Germany and Austria, it sounds like the same impact, the same of the vaccines. And as you know, the AstraZeneca and the J&J vaccine are the same platform. So there's clearly a similarity today. And so, although it happens, it's done because out of the term that's often used is the abundance of caution. But really, it's about transparency and about making sure that the public understands that everyone is watching, particularly when you have unlicensed vaccines, that we're looking to see whether there's these rare events, and we're going to assess whether these are real associations, causal association, and then whether the benefit outweighs the risk in continued use of these vaccines. I can't tell you what the ACIP is going to recommend today. I think, Governor, you're probably on the mark. If I had to bet on it, I would think that they're going to recommend continued use, maybe after a little bit more time, but maybe in a select population. But we'll see. What they're going to do today at the ACIP is they're going to review all the data. The manufacturer will probably present the details of those 6 cases. They'll probably review some of the AstraZeneca data too because of the similarity. There'll be some risk-benefit analysis, and they'll look at other databases to see whether there are other cases that have been missed, and that's what they're going to be looking for. Are there other cases other than these 6 cases that we perhaps need to look at as well? And of course, they've had a very intensive safety monitoring process for the COVID-19 vaccines, and the committee or the CDC point person will be presenting the data from the work group that was established just to monitor safety for the COVID-19 vaccine program. And I would expect that as I said, the ACIPs they're not going to walk out of the room today without providing some guidance. The public is expecting guidance. There's the pressure of the continuing pandemic with lots of cases around the country, and people are going to know, can we put forward the vaccine even though we have these rare events, or do we go and just use the 2-dose vaccines that we currently have? I mean, that's a big decision that needs to be made, but it needs to be made quickly.
Eddie, well said on all. The immediacy of this, I think, gets to the point on transparency. Let's be right up front about this, right? And I think that should give people comfort that actually they're dealing with this on an expedited basis. Thank you for all of that. Very helpful. Judy, any color on if I got my appointment canceled, how am I going to know? What am I going to do? Back of the line, et cetera.
To the first part of the question, we know this week we received 15,600 doses of J&J. So not all of them are immediately appointed. In other words, I haven't made all those appointments. So some percentage of that had to be rescheduled, and the rescheduling will take place through the local point of dispensing, through the local site, with the help of our call center, if needed. Right now, most of the large sites are keeping the appointments and filling them with Moderna or Pfizer.
Again, I'm sure that's not going to be that you all won't hear that, hey, I don't know, that somewhere in the system, this is a bump in the road, and we'll do everything we can to make sure folks get whole again in terms of appointments. Thank you both for that. Thank you, Dave. Nikita, good afternoon.
Good afternoon, Governor. I'm wondering if you have any plans to impose or loosen restrictions on beaches, amusement parks, or arcades in anticipation of the summer tourism season. And with the Gateway Environmental Review due to be completed in May, I'm wondering if you expect a groundbreaking sometime this year. And then I asked you about this last week, but the Senate has now scheduled a quorum for the 19th, so I want to know if you expect to conditionally veto the mandatory minimums bill within the next 5 days. And then finally, Democratic Governors Association Chair Michelle Lujan Grisham has settled a lawsuit brought by a former staffer who accused her of groping his genitals. I'm wondering if you believe that she should resign.
When you go off topic, you go off topic. Let there be no doubt about that. No news on beaches, amusement parks, or arcades, but I would expect they will be on a list of guidance that we'll be providing as we turn toward the summer season. I assume Paramount will agree with that. Not sure on groundbreaking on Gateway, but it's going in the right direction in a big way, and that's really good. The Portal North Bridge is ahead of it because we got the green light out of President Trump in June. So my guess is if we're thinking about putting a shovel in the ground, it may well happen at Portal North Bridge beforehand. Nothing new on mandatory minimums, although I note the same as you did, that the Senate has called a quorum for Monday. And I think Governor Lujan Grisham is doing a great job running the DGA. I'm its finance chair, so I don't make the jurisdictional decisions any longer as I did when I was chair, but I think she's doing a great job. And New Mexico, I think, is doing a very good job in the pandemic more generally. She's, by the way, the former health commissioner, Judy. Don't get any ideas. Thank you for that. Thanks to everybody. Very helpful discussion. Eddie, we won't see you for a few. Keep us in your prayers and in mind.
I will be in touch.
My commitment is when you come back, by the time you're back here, we have a quantum meaningfully improvement in the pandemic between today and then.
There'll be nothing for me to say.
There'll be nothing for you to say. You can come in and help Pat out with the weather. But Judy, to you and Eddie, thank you. And again, Eddie, we'll miss you, but best of luck to you. Pat, Jared, Paramel, to everybody. Again, folks, keep doing what you're doing. We're getting there. The J&J vaccine thing is a bump on the road. It's not the first bump on the road. Let's remember that. And I think you all have done an extraordinary job reacting to bumps in the road. And I just know New Jersey well enough to know that you all and we all together will react well and figure out this minor setback and get us back on track and get us to the point that we know we want to get to, which is, to your question, Nikita, a Jersey Shore summer, a summer at our lakes that we all will relish and remember forever in the best sense. And secondly, getting 4.7 million adult New Jerseyans vaccinated by the end of June. We are committed to both. God bless you all. Thank you.